I want you to do something for me right now. I want you to think about the last time you walked somewhere, down the hallway, to the kitchen, out to your car. You probably did not think about it at all. You just walked. And that is exactly the problem. Because the way most people over 50 are walking, the specific patterns and habits they have developed over decades without ever examining them, is quietly, consistently, and in some cases irreversibly damaging their knees, their hips, their lower back, and their spine. And the reason this keeps happening is not because people are careless. It is because nobody ever sat them down and said, "Look, the way you move has changed as you have aged, and those changes are costing you." So today that conversation is happening, and I promise you by the time this video is over, you will never walk the same way again, in the best possible way. This is one of those topics that feels simple on the surface but goes very deep when you really examine it, and the information I am going to share with you today is backed by research from biomechanics laboratories and physical therapy clinics and sports medicine studies, presented in plain English so that you can actually use it. So please stay with me through this entire video, because the things I am going to explain in the middle and toward the end are just as important as what I am telling you right now. Every part of this builds on the next, and if you are not already part of this community, please take just a moment right now to subscribe to this channel and hit the like button. At Dr. Alex Morgan Aging Wellness Lab, we are dedicated to giving you the real, practical, honest health information that helps you move better, feel stronger, and stay independent as you age. New content every week, made specifically for people who are serious about protecting their health after 50. Now, let us talk about what is actually happening when you walk, and why it matters so much more than most people realize. Walking is often described as one of the safest, most natural forms of exercise available to older adults, and in principle, that is absolutely true. Walking, done correctly, is genuinely wonderful for your joints, your cardiovascular system, your brain, your mood, and your longevity. The research on this is overwhelming and consistent, but here's the thing that the general advice leaves out. Walking done incorrectly, with the specific movement patterns that many older adults develop over time, is not neutral. It is not just less beneficial, it is actively harmful. And the damage accumulates slowly enough that most people do not connect their knee pain or their back stiffness or their hip discomfort to the way they have been walking. They just assume it is age. They take a pill. They rest more. And meanwhile, the movement patterns that are causing the problem continue unchanged, day after day, mile after mile, step after step. Let me start with something that I see constantly and that drives so much of the joint damage that older adults experience. It is the forward head and hunched shoulder posture during walking. When you spend years sitting at desks, looking at phones, working at computers, driving, your body adapts to those positions. The muscles in the front of your chest and neck shorten. The muscles in your upper back and the back of your neck lengthen and weaken. And over time, your head migrates forward from where it should be, which is balanced directly over your shoulders, to a position where it juts out in front of your body. Now here is why this matters for walking specifically. Your head weighs approximately 10 to 12 pounds. When it is balanced properly over your spine, your neck and back muscles manage that weight with relative ease. But for every inch that your head moves forward from its ideal position, the effective weight that your spine must support increases by roughly 10 pounds. So a head that is only 2 inches forward, which is extremely common in adults over 50, is creating the equivalent of carrying an extra 20 pounds on your neck and upper back every single moment you are upright. Now, what does this have to do with your knees and your lower back? Everything. Because the body is a connected chain. When your head is forward and your upper back is rounded, your center of gravity shifts. Your lower back must compensate by either increasing its curve, which is called hyperlordosis, and which compresses the lumbar discs and facet joints, or by flattening its curve, which is called hypolordosis, and which reduces the shock-absorbing capacity of the spine. Either way, the lumbar spine is now working in a compromised position, and when you walk in that compromised position, every single step sends forces up through the ground, through your foot, through your ankle and knee and hip, and into a spine that is already under abnormal stress. over thousands of steps per day, over months and years. This is how chronic lower back pain develops in people who consider themselves to be relatively active. There is another walking pattern that is even more directly destructive to the knee joint, and it is something that a surprising number of older adults do without any awareness whatsoever. It is walking with the toes pointed outward, what some people call duck walking. Now, a slight outward rotation of the feet during walking is normal and expected. Somewhere between 5 and 10 degrees of external rotation is within the typical range of healthy gait. But many older adults, particularly those with tightness in the hip external rotators or weakness in the hip internal rotators, walk with their feet turned out significantly more than that. 30 degrees, 40 degrees, sometimes even more. And every step taken with the foot in this position creates a rotational torque through the knee joint that it was not designed to handle. Here is the biomechanics of why this is so damaging. The knee is primarily a hinge joint. It is designed to flex and extend in a single plane. When the foot is turned significantly outward during walking and the heel strikes the ground and the body's weight rolls through the step, the tibia, which is the shin bone, is externally rotated while the femur, the thigh bone, is in a relatively neutral position. This creates a twisting stress at the knee joint with every single step. And over time, this rotational stress wears down the cartilage inside the knee, particularly the medial cartilage on the inner side, contributing to the kind of progressive knee degeneration that so many older adults experience and that so many doctors label simply as osteoarthritis without ever investigating what movement patterns contributed to it. Let me tell you about a woman I will call Patricia. She was 62 years old, a retired school teacher who had been dealing with worsening right knee pain for about 2 years. She had been to her orthopedic surgeon, had an MRI that confirmed cartilage thinning on the medial side of the knee, and had been told that she was on a trajectory toward knee replacement, possibly within 5 years, and that she should take anti-inflammatory medications and consider reducing her walking. She had also been a dedicated walker her whole life, walking 3 to 4 miles several times a week, and the idea of reducing her walking felt like losing a core part of her identity and her daily joy. When I watched Patricia walk, the duck walking pattern was immediately evident. Her feet were turned out at approximately 35 to 40 degrees throughout her gait cycle. She had also developed a pattern of lateral trunk sway, which is the side-to-side rocking of the upper body during walking that often develops as a compensation for hip weakness, and her head was positioned roughly 2.5 inches forward of her shoulders. In other words, 3 significant movement problems were present simultaneously, none of which had ever been identified or addressed by anyone who had treated her knee pain. Addressing these patterns through targeted movement retraining and specific muscle strengthening changed Patricia's situation in ways that surprised even her. Over 4 months of consistent work on correcting her gait mechanics, her knee pain during walking reduced by what she described as approximately 60%. She continued walking. She did not need to reduce her mileage. What she needed was to walk differently. And once she understood why, once the connection between her movement patterns and her joint damage had been explained to her clearly, she was motivated to make those changes consistently. Now let us talk about something that connects directly to the duck walking issue, but that operates through a different mechanism, and that is the role of hip weakness in walking mechanics and joint damage. Your hip abductor muscles, particularly the gluteus medius, are the primary stabilizers of your pelvis during single-leg stance, and walking is essentially a series of single-leg stance phases. Every time your weight is on one foot, your gluteus medius on that side must fire strongly enough to keep your pelvis level. When this muscle is weak, which is extraordinarily common in adults over 50 who spend significant time sitting, the pelvis drops on the opposite side with each step. This is called a Trendelenburg gait, and even subtle versions of it that are not obviously visible to the naked eye create significant downstream stress on the knee and lower back. When the pelvis drops on one side with each step, the hip on the stance side must compensate by shifting outward, creating that lateral trunk sway I mentioned with Patricia. This shifts the center of gravity over the stance leg in an inefficient way that increases the compressive load on the knee joint. Simultaneously, the pelvis drop creates a rotational stress on the lumbar spine with every step, contributing directly to lower back pain and accelerating disc degeneration in the lumbar region. All of this from one muscle being insufficiently strong, the gluteus medius, a muscle that most people have never heard of, have never specifically trained, and whose weakness has never been identified as the root of their knee and back problems. Here is the really important part. Gluteus medius weakness is not inevitable. It is a consequence of inactivity and prolonged sitting, and it responds beautifully to targeted strengthening exercises, even in people in their 60s, 70s, and beyond. The muscle tissue of older adults retains a significant capacity for strengthening with appropriate training. It is slower than it was at 30, but it is absolutely real, and rebuilding gluteus medius strength can change the mechanics of every single step you take for the rest of your life. Let us now address something that I think surprises most people when they first hear it: the role of stride length in knee and back health. Many older adults, either because of pain, because of reduced confidence in their balance, or simply because of habit, have adopted what is called a shortened stride pattern. Instead of taking full, flowing steps where the leg swings forward naturally from the hip, they take smaller, shuffling steps where the heel lands close to the body and the push-off phase is reduced. This feels safer. It feels more controlled. But from a joint health perspective, it is actually more damaging than a full stride, for several reasons. First, a shortened stride forces the knee to absorb a higher percentage of the body's forward momentum at heel strike, because the natural shock-absorbing function of the hip is not engaged when the stride is short. The impact goes into the knee rather than being distributed across the entire kinetic chain from hip to ankle. Second, a shortened stride significantly reduces the activation of the gluteal muscles during the push-off phase, meaning that every shortened step is a missed opportunity to engage and strengthen the muscles that are most important for protecting your joints. And third, shortened strides over time reinforce a rigid, guarded movement pattern that reduces the lubrication of the joint cartilage through normal movement, because cartilage has no direct blood supply and gets its nutrition from the synovial fluid that is pressed in and out of it during full-range joint movement. The next part is very important, and I want you to really pay attention here because this is something that almost nobody talks about in mainstream health conversations: the role of breathing during walking and its direct impact on spinal mechanics. Most people breathe shallowly and primarily into their upper chest during daily activities, including walking. This pattern, which is called accessory muscle breathing, means that the primary work of respiration is being done by the neck muscles, the shoulder muscles, and the upper rib muscles, rather than by the diaphragm. And here is why this matters for your spine during walking. The diaphragm, when it contracts properly during inhalation, creates intra-abdominal pressure that acts as a natural support system for the lumbar spine. Think of it like an internal airbag that helps stabilize the spine during movement. When you breathe shallowly into your upper chest, you are not creating this intra-abdominal pressure. Your natural spinal support system is essentially switched off, and you are walking around with a lumbar spine that is missing one of its most important stabilizing mechanisms. Relearning to breathe diaphragmatically, to breathe in a way that expands the belly on inhalation rather than lifting the chest and shoulders, is one of the least discussed and most impactful interventions for lower back pain during walking that I know of. And it is also one of the easiest to practice. Placing one hand on your belly and one on your chest during a few practice breaths, and training yourself to feel the belly hand rise and fall while the chest hand stays relatively still, begins to retrain this pattern within weeks of consistent practice. And when you bring that breathing pattern into your walking, the difference in spinal stability and lower back comfort can be genuinely remarkable. Let me now give you a practical framework for what good walking mechanics actually look like, because I do not want to leave you with only a list of problems without giving you a clear picture of the solution. Good walking posture starts at the top. Your ears should be directly over your shoulders. Your shoulders should be directly over your hips. Your chin should be parallel to the ground, not tucked down or jutting forward. Think about a string attached to the crown of your head gently pulling you upward, not rigid or military stiff, just tall, lengthened. Your shoulders should be relaxed and slightly back, not hunched forward. Your arms should swing naturally and freely from your shoulders, alternating with the opposite leg, which is what happens naturally when your posture is correct and your core is engaged. Your feet should point forward, or with only a slight outward angle of 5 to 10 degrees at most, not turned out, not pigeon-toed, pointing essentially forward. Your heel should strike the ground first, slightly ahead of your center of gravity, but not dramatically in front of your body. A heel strike that lands far in front of the body acts like a brake with every step, sending a shock wave up through the knee and into the hip and spine. The heel should land just slightly ahead, and then the weight should roll smoothly forward across the outside of the foot and push off from the ball of the foot and the big toe. That push off from the big toe is enormously important. It activates the calf, the glute, and the hip extensors. It drives the momentum of the next stride. And it is absent in most older adults who have shortened their stride or who are walking with the weight more on the outside of their feet. I also want to talk about walking surfaces and footwear, because these are factors that directly affect joint impact during walking, and that most people choose based on aesthetics or comfort rather than biomechanics. Hard, flat surfaces like concrete and asphalt provide no shock absorption, so every step sends a direct impact force up through the skeletal chain. Walking on softer surfaces like grass, packed dirt trails, or rubberized tracks provides meaningful shock absorption and also engages the small stabilizing muscles of the foot and ankle to a greater degree, which builds functional strength in exactly the structures that protect the ankle and knee during walking. Footwear choices after 50 deserve their own detailed conversation, but the key principles are these. Avoid heavily cushioned shoes with thick, elevated heels. I know this sounds counterintuitive because most running and walking shoes are marketed on the basis of cushioning, but research has consistently shown that highly cushioned, elevated heel shoes encourage heel striking with the foot significantly in front of the body, which increases impact forces at the knee. A shoe with a lower heel-to-toe drop, meaning less difference in height between the heel and the forefoot, encourages a more natural foot strike pattern that distributes impact forces more effectively across the entire foot and reduces knee stress. Adequate arch support is important, particularly for people with flat feet who tend to overpronate during walking, which creates inward rotational stress on the knee. And fit matters enormously. A shoe that is too narrow, that compresses the toes, interferes with the natural push-off mechanics that drive healthy gait. Let me circle back to Patricia for a moment, because I want to share the specific things she changed that made the biggest difference, because they are the things that are most transferable to your own situation. The first change was awareness. She began watching herself walk in the reflection of store windows and glass doors, not obsessively, but just periodically, to check whether her feet were turning out and to correct it consciously. The second change was targeted hip strengthening. 3 specific exercises, side-lying hip abduction, clamshells, and single-leg balance work, performed consistently 4 to 5 times per week, began rebuilding her gluteus medius strength within 6 weeks to a point where she could feel the difference in her walking stability. The third change was breathing. She practiced diaphragmatic breathing for 5 minutes each morning and consciously applied it during the first few minutes of each walk until it began to feel more natural. And the fourth change was posture cues. She chose 2 simple cues that she reminded herself of at the start of every walk. Ears over shoulders and toes forward. Just those 2 things. And they anchored the larger postural correction in a way that she could sustain without overwhelming herself. 4 months later, her orthopedic surgeon, the one who had predicted a knee replacement within 5 years, remarked at her follow-up appointment that her gait had changed noticeably and that her reported symptoms had improved significantly more than he had anticipated. He still did not identify the specific mechanism. He told her to keep doing whatever she was doing, but she knew. She had changed the way she walked, and changing the way she walked had changed the mechanical forces acting on her knee with every step, every day. And over thousands of steps, those changed forces had begun to shift her trajectory. I want to be honest with you about something important before we close. If you have significant arthritis, significant disc disease, or a history of joint surgeries, changing your walking mechanics alone may not eliminate your pain. The damage that has already occurred cannot be fully undone by gait retraining, but it can almost always be slowed. And the further damage that would have continued under the old patterns can be prevented or reduced. That is a meaningful and important outcome, even if it is not a complete cure. And for many people who catch these patterns earlier in the degenerative process, the improvement can be dramatic. The body you are living in right now is not finished responding to what you ask of it. Muscles can get stronger, movement patterns can be retrained. The nervous system can learn new ways of organizing movement. These capacities do not disappear after 50 or 60 or 70. They slow down. They require more consistency and more patience. But they are real. And the information you now have about why your walking mechanics matter and what healthy walking actually looks like gives you something that most people your age have never had. A clear map of what to change and why it matters. Please share this video with someone you care about who has been dealing with knee pain or back pain and who has been told that this is just part of getting older, because I promise you, if they watch this entire video, they will look at their own movement differently. And that shift in awareness is where everything begins. Post it in your family group. Text it to a friend. Send it to someone who has been struggling. A 2-minute share could change the way someone moves for the rest of their life. And please leave a comment below before you go. Tell me whether you recognized any of these patterns in yourself. Tell me which of the things we discussed surprised you most. Tell me what you are going to start paying attention to the next time you take a walk. This community is built on real conversation, and I read every comment personally. Your experience matters here, and your words help the next person feel seen and less alone in what they are dealing with. Take good care of yourself. Walk tall. Walk forward. And I will see you in the next video.